Well, I'm going to participate in two sessions. One is related to the barriers that women faced in breast cancer control in Latin America, and the second one is about how to use the law as an efficient mechanism in cancer control. I would like to answer that question with this example of what is happening right there in Latin America. There are 9 countries that already has a law specifically to attend cancer control, a federal, national, or simply a law for cancer. And for example, in Mexico, we have been working for the last two and a half years pushing this similar law in order to establish a national cancer control plan for our country. In contrast with the United States, they already have both a law and a comprehensive national cancer control plan. The first one 53 years ago, and the second one more than 20 years ago. And it turns out that the WHO recommended to more than 190 countries around the world to construct national cancer control plans in order to have a public policy to address this disease. The thing here is that in Mexico we lack of both a law and an NCCP. The protection of health is a human right, and it is supposed that in every single country it needs to be executed. People need to be protected, and governments need to act. But it turns out that it doesn't happen in every country. So that's the reason why we are pushing laws in order to obligate governments, states, to construct these plans, and furthermore to provide with access, treatments, hospitals, infrastructure, and the more important, to increase the expectancy of life for cancer patients. In Mexico, we promoted amendments to 3 federal laws in 2019 in order to provide with occupational leaves for parents of children diagnosed with cancer. And after almost 3 years of hard work within the Mexican Congress at both chambers, the Mexican Senate and the House of Representatives, we obtained the approval of this amendment, this legal initiative. And nowadays, fortunately, we have more than 24,000 parents benefited with this new right in our country, which means that they can be aside with their children during the oncological treatments for up to 1 year, and the government has the obligation to pay them 60% of their salary during this year. Well, but the main problem we have regarding breast cancer is the late diagnosis, and it is related with cultural matters. You know, women in some cases, depending on the region in which they live, in some cases they don't want to go to the doctor to have an screening, or in some other cases, if they are married, probably the partners do not allow them to go for a check, right? And the main thing here, or the problem, is that according to the Pan American Organization for Health, by 2040, the numbers we have of women diagnosed with breast cancer will increase to 40%. That's one of the reasons why we need to take actions, and that's one of the reasons why we are here attending the World Cancer Congress 2024 in order to share some experiences and good examples of good practices in different countries, and of course put in a lower number what is considered by PAHO from here to 2040.